So now for the next drug we should be talking about, why we'll actually need to monitor this drug, is aminoglycosides. Okay, aminoglycosides. So we're looking at the different types of aminoglycosides. If we're giving it to a patient, what would be the reason why we now still want to come back and be monitoring for the levels of this drug in systemic circulation? So aminoglycosides is not a single drug, it's a classification of other drugs, alright? So drugs like gentamicin, tobramycin, amikacin, okay. So monitoring them is very essential because they are good antibiotics. They help us fight bacteria, but they could have their toxic potentials. So why the aminoglycoside monitoring is very important is they have a narrow therapeutic index. That means the range at which this drug will be very nice to you and the drug becoming toxic to you is just a thin line that divides it. So you have to keep monitoring to ensure that it is within that range. Concentration dependent killing. So for it to also act on the bacteria, it depends on the amount of the drug that is in the body. Okay, so risks of toxicity. So it can be toxic to your kidneys, it can be toxic to your ears. You understand? So they are monitoring it so that it doesn't go outside that level which is user friendly. Variable pharmacokinetics. So clearance depends very, very much on how the person's kidneys are functioning. So if your kidneys are not functioning well, okay, this drug can now have a backlog in your system and become much more toxic. Okay, so optimizing dosing. So for the actual therapeutic drug monitoring, like for it to be user friendly, it usually supports just once daily dosing, okay, or extended interval regimens. Okay, so this is just it for the targets. So when is it performed? Like when will you actually want to monitor the drug levels in the body? Alright, so initial dosing, after you dose, or if the person's kidney function is not really optimal. So if you are going to give the drug across 3 days, you keep monitoring. Okay, and if the person is an elder, the person is critically ill, or the person is also taking some other drugs that are harmful to the kidneys, they might actually just want to keep monitoring this patient so that I see that things don't actually get out of hand.